So, Dr. Nicole Kanaris, thank you again for joining me on Aesthetically Speaking. Today, we're going to talk about the vampire facial that was becoming so famous overseas, and people were talking about this, and some people think, oh my goodness, it sounds awful. You're going to explain to us that it's not that scary.
So I think it was made famous by Kim Kardashian, in fact, and her experience on her program was screaming and crying, and it was so dramatic. She was pregnant at the time. She didn't have local anesthetic. And remember, it's a reality show. They got to create content. It's got to be interesting. If someone's just lying there, maybe people won't be as interested in it. Yeah. So for us, we use local anesthetic cream. There's very little felt. I'd say 90% of our patients feel hardly anything. We take it off area by area, so the cream stays on for a long amount of time. And like the eye area where the skin's so thin, you hardly feel anything.
Okay, but the good news is, and for pregnant ladies, now that you mentioned
yes,
that Kim Kardashian was pregnant, there are a lot of procedures or products or whatever that you can't, do when you're pregnant. And this now, you say
you can do it. You just wouldn't be able to put the local anesthetic cream on. So a lot of patients tolerate that really well because we have patients in our clinic who don't want cream and they do a lot of treatments without it.
Okay. So take us through, because it is using your own blood. You're going to take us through the procedure and we'll discuss the benefits thereafter. So take us through.
So in our clinic, we welcome the patient. We make sure they're a candidate. We take them through for a Visia, which is a facial analysis. We then apply the local anesthetic cream. I then take blood from them, which is like a normal blood test, small vial. We spin it in a specific machine, which is called a centrifuge. Mm-hmm. We then spin it for a specific amount of time so all the components separate. We will then take out the PRP, which is the platelet-rich plasma. It's gold in color. We call it liquid gold. So it's this clear gold color. We take that and we inject it into the skin. Now, there's different ways of doing it. Yes. And you're probably going to ask me, what are those ways? Yes. So I am a trainer for other doctors in South Africa, and it's truly based on the skill sets. So if you're comfortable using a microneedling device, you can put the platelets on and then you can microneedle them in. Okay. I like to use my hand. I like to use a syringe. I use a needle. It's called an invisible needle. So it's really, really tiny. And I can get into all places and deliver maybe an increased amount to what would be penetrated with microneedling. I like to treat around the eyes, and inject really close to the eyelid. I also like to inject onto the bone under the eyes for tear troughs. And we've seen some really good results in patients that have got tear trough hollows, where you're really deep there, in patients with a lot of laxity on the eyelid. I'm not saying it's a replacement for surgery in patients with excessive eyelids and hooded eyes, but for patients who are starting to see a little bit of laxity in the skin, it's a great treatment for that. Nasolabials, fine lines around the mouth, crepiness of the skin in this area, pigmentation, hypopigmentation works really good for, white splotches on the skin, patients with uneven skin tone,
acne
scarring and acne.
Okay.
Healing of active lesions, faster healing of those lesions. We found it works really well for those patients too. So it's regenerating. It's injecting growth factors into the skin, and those call on your stem cells to regenerate that skin, give you healthier skin, improve your skin quality, giving you glow.
Okay, it all sounds absolutely marvelous, but just remember that we're all different and results will differ from one patient to the next.
Exactly.
Let's talk. So those are the benefits. So we've spoken about smoother skin, a glowier skin, a reduction of fine lines, maybe plumper skin, reduction of acne scarring. So don't forget, self-esteem comes into it as well. because a lot of people who've got uneven skin tone or acne scars might feel, that they're not their best. They're not looking their best. So this helps with a boost to your self-confidence.
Definitely. And also, like, it's the time of no makeup.
Yes.
Most people want to be makeup free. And for patients with acne scarring or, a whole other like skin tone issues, they tend to cake the makeup on.
Yeah.
So now we've got a treatment that can really help to even out that skin tone, to give you beautiful, healthy skin.
Yes. Functional, healthy skin, that's what we're after all the time. Okay, so who should not perhaps consider this PRP treatment?
So
it's not a candidate.
So we spoke about the pregnant ladies who can't tolerate a little bit of pain, who don't want the local anesthetic. Okay. We would look at lupus patients. If they've got systemic lupus, we know that lupus can present in the skin as a rash on the face. And so we would be quite cognizant of the fact, if the patient has lupus, not to do a vampire facial. There have been cases where then it forms a skin rash afterwards. But not many other patients. I think if you've had skin cancer on your face, you would need the all clear from your dermatologist to know that there isn't anything there, that you don't have any active lesions.
What if you're on blood thinners?
So blood thinners, we would want no anti-inflammatories, no one on aspirin or dispirin, because this affects the platelet function. Okay, and no cortisone.
Okay.
So yeah, platelets definitely are affected by, your things for clotting problems. So your aspirin and dispirin.
Or I think everybody just thinks as a vampire fashion that you're going to bleed like a fountain.
Oh my gosh, were you thinking that way?
Blood thinners might.
So look, okay, when you take blood and then you've got to compress it, they've gone into a vein. But if you're injecting the skin, we're not going into the blood vessels. So you will have a bit of what we call pinprick blood.
Yes.
Like little pinpricks where you see blood.
Okay, so you can drive home and
you might be a bit red and sunburned, but nothing more than that.
Nothing that a lovely big pair of sunglasses and a hat.
Exactly.
Fine. You can go to Woolies afterwards.
100%. Okay. Definitely.
All right. And then in terms of the health, coming back to the health of a patient, because we're dealing with blood. So perhaps like 2 weeks before or a week before that, you're having a procedure, might it be a good idea to, eat clean, eat well, look after yourself, get your beauty sleep and all that? Or am I just am I overthinking it?
So look, health is always first. And I think to be healthy, you do need good sleep, a good diet, a lot of exercise. Some people say mindfulness, whether it be meditation or religion that's giving you that. So those things are all important. Also the medication, whatever you're putting in your body. We have taken patients' blood where it looks like pus. It's like this milky white color, the platelet, the plasma. And that is because of a very high content of fats in the blood. So they might have very high cholesterol. Would it impact the treatments? Not really. But we are here to make patients the healthiest they can be.
And you want the best results.
Yes. And they might not know that. They might not know they've got high cholesterol. And you look at their blood and you can see it. Or I took blood from my mom and it clotted so fast, I could tell she had a clotting problem. So there's things like that. We are doctors first. We want our patients healthy. This, as much as people think it's a beauty treatment and they can just go to their closest spa and do it, this is medical. We're taking your blood. We're then re-injecting it into your face. And our main concern is your health and well-being. And it should always be that.
Yes. And please do your homework. Make sure that you go to a registered doctor and you will have a sterile environment where the procedure takes place. It can't take place at a party or somewhere. We're dealing with your blood and you're dealing with injections, and that is standard.
Yes, I mean your skin is an organ. You are breaking its barrier, and its function is to protect your body. the inside from the outside. So you need to make sure that it's done in a healthy place. They're using clean needles. They're using proper machinery. It's your blood that they're going to be putting back in. Yes, that's your responsibility to check that those things are happening, and that you're in the right place for the procedure.
And then the last question would be, and I know I'll preempt it by saying, yes, each candidate is going to be different. There's going to be, say, I go for it and I'm 63 years old and my benefits will show, say, 3 weeks later or whatever. And say a much younger woman will go and she'll have a different outcome. But more or less, when do you see the benefits? Okay. Is it straight away or is it a couple of weeks after? And to maintain that lovely glow and the smooth, functional, beautiful skin, in your opinion, how many of these facials should you have, say, per year?
So with the microneedling, so any needle that goes in the skin, within a week, you're already seeing a lot of glow and repair of the skin. The PRP will take a little bit longer to work because it's regenerative. So your body's working under the surface, improving and building and healing. It can take up to 3 months from the first session, but you every day would see a change. Okay. And then, yes, it definitely depends on your age, your concerns, the level of damage to your skin, how many you would need. If you could do a vampire facial every month, I'd say do it. Probably be the best thing. It's safe. It'd probably be the best thing for your skin. But possibly like 1 a month for 3 months. Then you can continue with your standard microneedling and then give yourself a boost every 3 to 6 months with a vampire facial in between. That would be a good.
So that would be lovely if somebody was getting married, say, well, they've got a big event and then you want to just you schedule a couple before the day.
The day, yes.
So that your skin is at its best.
So then do your 3, I would say. The plan is that you do 1 a month until the week.
But always remembering that it's your own body doing the regeneration and that. So it's not like instant gratification like a filler.
Definitely not, yeah.
But you're using your body to regenerate and heal and do all the good stuff.
Yeah. So for the eyes, like if you've got deep rings under your eyes, we found that you needed to do 1 a month for up to 3 to 4 sessions before you're going to see a great results.
Yes.
But it's all different. It really does. It's variable and patient specific. Some people just heal so beautifully and others take longer.
Yes.
So it also depends on your healing potential in your body.
Well, thank you so much for explaining so beautifully. I'm all in. I think it's great. I think regenerative medicine is fascinating. I hope you learned as much as I did. Thank you again for joining us on Aesthetically Speaking.
Thank you so much for having me. I appreciate it.